Good day, everyone. I'm Mary Rose Gravy Rodriguez from BSN2MD. Today, I will be discussing the obesity drug combination against naltrexone and bupropion, commonly known as Contrave. This presentation is part of our pharmacology course and will focus on the drug's mechanism, effect, safety consideration, and nursing responsibilities. As future nurses, understanding this medication is important because obesity management is becoming a major part of patient care. So now let's proceed for the introduction to obesity. Obesity is a chronic relapsing metabolic disease, meaning it requires long-term management and often come back without continuous lifestyle changes. It is caused by multiple factors including overeating, genetics, sedentary lifestyle, and hormonal imbalance because obesity leads to complications like diabetes, hypertension, dyslipidemia, and heart disease. Proper treatment, including medication when needed, is crucial. So, why use combination agents? Combination agents are preferred in some cases because they produce greater weight loss compared to using a single drug alone. Each medication works through different mechanisms, so their actions complement each other. With combination therapy, lower individual doses can be used, reducing the risk of side effects. A single combination pill can also improve medication adherence because patients don't have to take multiple medicines. In the Philippines, the only combination agent obesity against that is registered with the Food and Drug Administration is naltrexone and bupropion, known internationally as Contrave. Being listed in the FDA Philippines Drug Product Verification portal means that medication has undergone evaluation to ensure it meets that standard of quality, safety, and efficiency before being allowed to enter the Philippine market. This assures both healthcare providers and patients that the product is legitimate and approved for local use. It is classified under weight management medications intended for long-term obesity treatment. Since it is a prescription-only drug, patient must be evaluated by a physician first to determine if they are medically eligible to take this medication. For component overview, this drug combines two active components. Bupropion is a dopamine, norepinephrine reuptake inhibitors that improves mood and reduces appetite by increasing certain brain neurotransmitters. Meanwhile, naltrexone is an opioid receptor antagonist that reduces cravings and emotional eating by blocking rewards pathways. Together, they help patients manage hunger and control unhealthy eating habits. Mechanism of action: naltrexone and bupropion work together on two major areas of the brain. In the hypothalamus, they reduce appetite and help patients feel fuller with less food. In the mesolimbic reward pathway, they decrease cravings and urge to eat for emotional comfort. They combine effects lower caloric intake and support steady, sustainable weight loss. Pharmacokinetically, bupropion is primarily metabolized in the liver through the CYP2B6 enzyme, which affects how long the drug stays active. Naltrexone is also metabolized in the liver and has an active metabolite that enhances its effect. Both drugs are mainly excreted through the urine, which means kidney functions plays a role in eliminating them from the body. For indications, this medications is indicated for adults with BMI of 30 or higher. which is classified as obesity. It is also recommended for patients with a BMI of 20 or above if they have weight-related medical conditions such as hypertension, diabetes, or abnormal cholesterol levels. These conditions increase health risk, so weight reductions becomes even more important. Dosage and administration. The dose of naltrexone and bupropion must be increased gradually every week to allow the body to adjust and prevent side effects. It is taken orally with meals for better absorption. The patient must not crush or chew the tablet because it is an extended release formulation and breaking it can cause too much drug to be released at once. Therapeutic effects. Therapeutically, this drug combination result is an average weight loss of 5 to 8% of total body weight. It significantly reduces cravings, making it easier for patients to avoid overeating. It also improves glycemic control in diabetic patients. Overall, the medication helps patients gain better control over their eating pattern and calorie intake. Adverse effects. Common side effects include nausea, dry mouth, headache, constipation, and difficulty sleeping due to the stimulating effect of bupropion. Some patients may also experience an increase in blood pressure. Their reactions are usually mild, but monitoring is essential to detect any worsening symptoms or serious reactions early. For contraindications, this drug should not be given to patients with seizure disorders because bupropion lowers the seizure threshold. It is also contraindicated in eating disorders like bulimia due to electrolyte imbalance risk. And patients with uncontrolled hypertension should avoid it because it may further raise blood pressure. It is not recommended also during pregnancy, and it must not be used by patients who take opioids as naltrexone can trigger withdrawal. For drug interactions, the most important one to remember is MAOIs, which stands for monoamine oxidase inhibitors. These are older antidepressants that prevents the breakdown of neurotransmitters like dopamine, serotonin, and norepinephrine. Because bupropion also increases dopamine and norepinephrine, combining with an MAOI can lead to dangerous overstimulation including hypertensive crises and seizures. Opioids are another major interaction. Naltrexone blocks opioid receptors, so if a patient is currently using opioids medication for pain, it could immediately trigger withdrawal symptoms. Other antidepressants may also interact because they can either add to serotonin imbalance or contribute to lowering the seizure threshold. Lastly, alcohol must be avoided because it increases seizure risk, especially when combined with bupropion. These interactions highlight why careful medication history is essential before starting naltrexone and bupropion therapy. For nursing responsibilities, as nurses, we must obtain baseline blood pressure, weight, and BMI to track the patient's progress. Assessing their dietary habits help guide proper lifestyle changes. We must teach patients to follow the titration schedule and watch for mood changes or signs of depressions. Since both drugs are processed in the liver, monitoring liver function is also important. For patient teaching, For patient education, we need to explain the importance of avoiding high-fat meals because they may worsen side effects. Patient must strictly follow the dose increases schedule and avoid alcohol to prevent seizure risk. Most important, we need to remind them that this medication works best when combined with long-term lifestyle changes and diet and physical activity. In summary, naltrexone and bupropion is an effective combination drug that reduces appetite, decreases cravings, and promotes meaningful weight loss. It is FDA registered in the Philippines and can be used safely with proper monitoring. However, it is still requires lifestyle changes and nursing support to achieve the best outcomes.